What's going on, guys? Tony here, and if you haven't received a green envelope from Noridian asking for a post-payment review, you might want to watch this video to find out what you could be expecting down the road. So guys, if you don't know me, my name is Tony Middletown. I'm a licensed physical therapist and private practice owner. I teach the Zero to Paid Medicare Billing course, which is a course designed to help clinicians start building their own private practice and understand how Medicare billing works. So recently, there's been a dramatic uptick in individual therapists who are private practice owners who are receiving two notifications from Medicare. One is a green envelope coming from Noridian asking for a post-payment review. That's what we're going to be talking about in today's video. The second is a notification from your MAC starting prepayment reviews. It's a TPE. We're not going to discuss that here. I'm collecting more information for you guys. I'm going through this process right now with my private practice, so I will share that information with you as it develops. But I'm also going through the post-payment review. So let me share a little information. And I'm going to share an APTA article that was posted yesterday, January 31st, to kind of give you some background on this. So let me share my screen. Behind me on the screen, you can see these are the 19 items requested by Noridian to complete their post-payment review. So some basic stuff. Where'd it go? Get back here. We have physician, non-physician order or evidence of intent to order. His history and physical reports, including medical history, current list of medications. Beneficiaries' medical records, which may include practitioner medical records, hospital records, nursing home records, may include. Number 4, documentation to support the NCD, National Coverage Determination or Local Coverage Determination policy article. Number 5, the initial evaluation re-eval signed by the ordering physician. So when I received this, I perceived it to be a list of what I need to submit. If my case doesn't apply, I don't submit the documentation. So for example, under item number 4, the LCD, if I don't need to support either medical necessity, my clinical decision making, or why I believe this is a covered service based on the LCD guideline, I was under the impression that this isn't something that I need to submit. The LCD guideline is simply put out by my MAC as a way to help me understand as a provider what is a covered service. Let's take a look at the APTA's recent article. This was published yesterday, January 31st. Noridian audits call for documentation that could be impossible to provide. I don't know if that's just kind of headline clickbaity or what. Read the article. It's a great article. What I want to do is I want to read the requests and responses because I think that's where you'll get the most value here. So one of the requests, which I already read, was physician, non-physician order or evidence of intent to order. Now, the APTA's position, your response would be the physician, non-physician practitioner orders or referrals are not required for outpatient physical therapy per Medicare Benefit Policy Manual, CMS Chapter 15, Section 220.11, which is totally true, totally accurate. If you go in, this is what the document looks like. You scroll down to Section 220.11. I'm going to zoom in here. So right here, which actually they kind of have a little typo, they said 220.11. It's actually 220.1.1. Although there is no Medicare requirement for an order, when documented in the medical record, an order provides evidence that the patient both needs therapy services and is under the care of a physician. The main thing that is required is certification of the plan of care. But so on one hand, yeah, 100%. APTA is right. We don't need a physician order unless your state doesn't have direct access. But on the flip side, I think most of us have a physician order. If we don't have one, we don't submit one. I don't think it's a big deal. But the idea is if you have it, submit it. It's not a big deal. History and physical report, including medical history and current list of medications. Again, this is not required by Medicare guidelines. It's recommended. It is optional documentation. It is not required. If you go into that same CMS Chapter 15 document, scroll down to the documentation under evaluation, you'll see they're listed as an optional element of the eval. But I don't know any physical therapists who are not taking a comprehensive history and not doing like a physical exam and not collecting information about medications. So I just think that they're kind of making a big deal out of nothing that's that big of a deal. So the request related to the LCDs and NCDs, I already addressed this. So APTA responses, this documentation is not required by Medicare. It's not. It's published by Medicare. It's provided by the Medicare MAC so that we can better support how we made our clinical decision and what we believe to be a covered service. So if you're doing something that is questionable, provide the reference to the LCD and include the LCD. The initial evaluation re-eval signed by an ordering physician or practitioner. This is true. The Medicare Benefit Policy Manual indicates that neither the evaluation nor the re-evaluation needs to be signed by a physician. What needs to be signed is the plan of care. The plan of care has three crucial elements, or at least I count them as three. The diagnosis, long-term goals, type, duration, frequency. Type being physical therapy, duration being how many weeks is your plan of care, and frequency being how many visits per week. The amount could be also populated if you're seeing a patient more than one time a day, but most of us in outpatient are not seeing patients more than once a day. And then, of course, the signed and dated overall plan of care, including short and long-term goals and any updates to the plan of care. So the APTA position, the Medicare Benefit Policy Manual requires the plan of care to contain long-term treatment goals only, but specifically indicates that short-term goals are optional. Yes, once again, optional. All of the physician order technically is optional but recommended. Short-term goals are optional. Even stuff like goniometry, right? Like there's no indication in the Medicare Benefit Policy Manual that goniometry, that pain levels, that so much of what we do are required. There's actually a very thin list of true requirements when you look at the Medicare Benefit Policy Manual, which I highly encourage you to do. But once again, I have yet to meet another therapist who's performing evaluations and developing plans of care who doesn't in some capacity utilize short-term goals, impairment goals, stepping stone goals to the long-term functional goals, unless of course you're doing a one-time visit home exercise program. This one, absolute, we're on the same page. Records of aid visits or times and dates. Therapy aides are not permitted to provide outpatient therapy services under Medicare. So while once again, technically this is 100% accurate, there are occasions where therapy aides would provide non-billable services, non-covered services. Medicare gives you the option to document that information in the medical record or not. It's your discretion, but true, for covered services that are paid for by Medicare, aides are not allowed to deliver those services. So all in all, I definitely appreciate the APTA putting this article out. I'm so glad that it brings light to the topic because I think this is something that we certainly need to pay more attention to. I can tell you that in 21 years of private practice ownership and however many years that I've been a therapist, this is the first time that I'm going through any of this. But that being said, rely on the resources. Rely on CMS Chapter 15, the Medicare Benefit Policy Manual. Rely on the local coverage determination, the national coverage determination. The resources and references are out there to help guide your decisions. And as long as you have internal systems and policies that make sure that the decisions are made within the guidelines set forth by the payer and the State Practice Act, you should have no problem going through this review. So guys, let me know your experience down below in the comments. Let me know if you've been through this or you haven't been through this. If you want to see another video that I think YouTube wants you to see, take a look at this thumbnail right here, and I'll catch you on the next video.